We know more, so we should be able to do better. I feel like that's our responsibility to our patients and to this profession. When you know more about how the nervous system works, about how subluxation destroys nervous system function, and about how chiropractic restores it, you get better at it. All right, chiropractors and chiropractic students, welcome to the Family Practice Podcast. You know, the one you've been waiting way too long for, because this podcast will actually stay focused on chiropractic. Not only what it takes to get world-class clinical results for kids and families in your community, but also what it takes to build a legendary, incredible family practice that takes care of your family way beyond your dreams. I'm Dr. Tony Ebel, and I'll be joined by Dr. Matt Hill, Dr. Ellie Wright, Jackie Jacobowitz, and incredible guests, chiros, associates, CAs, all these folks making massive impact around the world. We're going to cover everything: pediatric, perinatal, family practice. This is the podcast you've been waiting for, because moms and dads and families have always needed us. Now they're finally ready for us. I hope you're ready for the Family Practice Podcast. Let's go.
Welcome to the Family Practice Podcast, everyone. My name is Dr. Matt Hill, and I'm joined by a guest who you may have never heard of before. In fact, or maybe you have. His name is Dr. Tony Ebel. He is one of the hosts here, not just one of the hosts, probably the host here. And I'm so excited to be joined by him, because we're going to talk about a topic in this episode that we have been stirring over for the last 2 to 3 years in practice.
Yeah, it's something that I think we always knew, but didn't know. You know, parents tell us that all the time, like, oh, this part, the perfect storm makes sense. I knew pregnancy was stressful. I knew that birth was traumatic and I had to do something about it. I knew that another antibiotic was going to make things worse. So the parents had this deep down gut. When we were taking on these tough cases, which God has sent us and the world has sent us over these last many years, we knew that we were right on top of things with subluxation, but I think we knew there was more, or at least more clarity into these 3 stages. And I'll just never forget, and we'll start there with the story that kind of sparked this. But I will never forget the aha moment where it went, OMG, not even necessarily, brother man, what we'd been missing, but now that we know that we know that we know, we could double down on this clinically and really get the best results ever.
Yeah, it's such an interesting arc with how we learn this. We love studying subluxation, first off. So that's what we do. And we started seeing more and more kids with just straight chronicity to it. So it wasn't just that, it was just in their history. It was in their scans. It was in their presentation. It was tableside. And it wasn't just the 17, 18-year-olds that we were seeing anymore. The ones that, historically you'd expect. But it was, 7, 8-year-olds that would come in, slouched, tired, worn out, 5-year-olds. And then we even started to see it more objectively in our scans and even babies. And so we had to look at this subluxation arc in a different way of not just, what we thought of before. It's like, oh, you're subluxated, you're sympathetically dominant, right? It was much, much deeper than that.
Yeah, you know what? We're going to get super, super nerdy neuroscience-y on this one. So we should probably just actually come back to home plate and first base and just get everybody started there. Not because we don't think everybody listening is just, a lot of you are going to be exactly like us, obsessed with the science of subluxation and philosophy. So a lot of you are starting on third base, but we also can just understand that most of our education and most of our, interpretations of subluxation stay stuck on the spine. So let's just spend 30 seconds there. When we look at subluxation and we talk about subluxation, we don't see the bony elements. We don't not see them, but we don't focus on the structural musculoskeletal elements. It starts with the nervous system understanding. And so when you start seeing subluxation through a neurological lens entirely, then you can take that deeper. What does it say on the box of the insight when it comes? Look deeper. And so this is a deeper understanding of the progression of subluxation. And so when we started to look into our clinical case histories, we saw, unfortunately, so actually a lot of this conversation today isn't that fun, right? We're really talking about the severity of subluxation in the current pediatric and family practice population, but we saw greater depth. We saw more perfect storm stressors earlier and worser. I know worser is not a word. We saw more struggle in that kid's life earlier and worse. We saw more medications, more interventions that they tried to get to. And so we saw more depth. We saw severity. So I think that led us on the hunt for sure to say, well, we better understand subluxation and neurological dysfunction, dysautonomia, all the things. We better understand it deeper so we can handle it better clinically. So everybody listening, those might be our two, combine those words in your understanding and how you're going to apply this in clinical practice. You have to understand the depth of subluxation, more depth, and then you can apply that and get better results. And that's really the 1-2 punch.
Oh, 100%. It's all about the results.
But we needed help figuring out, didn't we? From our, and he's going to get interviewed in here tomorrow. So crazy timing, talking about the neuro age of chiropractic. So it'll probably come out around this podcast episode. But we needed Dr. Fletcher to just teach us with that depth and clarity.
Yeah. And I think Dr. Fletcher is the perfect one to just give a shout out to here, because he talks all about how it's all about the neuro age, right? And it's about the nervous system. So you just put neuro literally in front of every word. And when we started to look at the nervous system, we started to see that all those T's that were coming at it, they wouldn't just impact it to subluxate the nervous system, but they would do it in these stages.
Yep.
And one thing that he pointed out to us, when you really look back neurologically in how just, you go through that arc of how the perfect storm happens. And because we were so into that, we were looking like, well, here's how the perfect storm develops, right? As really just call it a culmination of everything that happens in the perfect storm. But the way he really explained it to us is there's this cliff that you hit, where if the nervous system gets stuck on the sympathetics, right? And who's not been there, right? With their kids, with themselves, with stress, right? The sympathetics are meant to be sympathetic. They're meant to help us through stress. You can be in the sympathetics very safely, where you're living your best life, you're doing great things, you're pushing for a season. But when you get subluxated there and it gets stuck on, well, then Dr. Fletcher coined this term that you just fall off that sympathetic cliff. And I think that's when it really clicked for us. That we're like, oh my goodness, what happens next?
And I don't think anybody listening can miss this. We weren't just looking at this in case histories and symptomatic presentations. We certainly weren't looking at this on x-ray or postural exams, because this is a neurological concept of chiropractic. So you can surmise the neurological dysfunction through an x-ray and through palpation, but you can see it clearly through neurological testing, the insight scans. So you can't really be a nervous system focused chiropractor if you don't track it, if you don't measure it, and you don't make sure that it's improving. Because remember, scans aren't just for your starting out conversation. That's actually like if you were to put it against it, it's not the least value, but the most value of scans is what we are doing working? Is this this patient's nervous system changing? And so when especially you, who is an HRV wizard, literally in love with it, understanding it, studying it like Dr. Fletcher, you at this season, I remember, had spent a lot of time studying HRV through research, through textbooks, through even performance, right? Like endurance and ultramarathon sort of stuff, because you're in that world. We won't talk about the mindset choices you've made. We'll just talk about the HRV on this, brother. And so you had that in your mind. We had that in our discussions. And then we were teaching at the seminar. We were teaching at the Neurotonal seminar. We were teaching our tribe about chronic cases, complex cases, exhausted cases, and just these really shut down clinical presentations we had seen. And you had really led the charge to dive into the HRV data table. So I actually want to go there. I kind of want to, and everybody listening, if you're like, what the heck are these guys talking about? Don't worry. We're actually going to we went 101. We're actually going to swing PhD, and then we'll come right back to the middle and we'll say, okay, here's the exact 3 stages and what they are and how you handle them clinically. But when you look at the HRV data table, it's full of granular information.
Yeah,
right? And at first it confused us.
It's fascinating though.
Or me. Maybe not you, but me.
No, and it's fascinating because we've been taught, in school and in our life, and we just, you embrace this, that there's this sympathetic, parasympathetic, and it's a teeter-totter and they're verse each other, right? Taught it. And that's not a bad way to explain it to patients, by the way. If you do that to patients, it's a good way to understand. It was a great way that we got brought up in chiropractic, and we were like, well, the sympathetic's on, the parasympathetics must be off, right? They're inverse.
Better hit the brakes.
Yeah, better hit the brakes. But it's a lot more complex than that.
It is.
In fact, when you look at these data tables and just the science behind the autonomic nervous system, you see that the sympathetics and the parasympathetics, they actually work together. They actually can have power together. And so
Can I pull on this a little bit, buddy? Because you're so good with this. And it took me a long time. Listeners, it took me a long time. I basically had to ask Matt and Dr. Fletcher the same question 3 times over to get clarity. So I'm going to switch just to interview mode instead of discussion mode. Power. Power with an HRV would translate to
autonomic
reserve capacity activity.
So think about it as autonomic activity, reserve capacity. It's really, I mean, think about it simply
Battery
as a body battery for your nervous system. The more autonomic activity you have, tie that to the systems that's tied to, right? That's more digestive power. That's more respiration power. That's more the body be able to go on autopilot. I like to say autonomics are your automatic systems. How much power do those have?
And how efficient can they work?
Yeah,
if you're going to ask your body, if you're going to ask a growing, developing body, by the way, what are we going to ask most of our patients to do, pediatric patients? We are going to ask them to heal and recover so they have a dysfunctional, dysautonomic, subluxated nervous system. So it needs to, this is in Stevenson, which is right over our shoulder. It takes often the same amount or more energy to heal as it does to develop. And so kids take a lot of power. They drain their battery. That's why they sleep so much. That's why they take naps when they're little, because they're developing so fast. So growing and developing is extremely draining in a normal, natural way on power and body battery, nervous system battery. And then healing is extremely draining on the body battery. And so when we look at HRV, if I can just ask one more question, brother, to get to full power, full development, full healing, full health and vitality, don't you need both the parasympathetics and parasympathetics juiced?
And that's exactly it. Because what we would see was
we make the sympathetics the bad guy, and they're not.
They're not. We would actually see the inverse in kids that were completely tanked and subluxated and stressed. They wouldn't just lose the parasympathetics, which is what we all think, right? You're like, oh, this kiddo can't settle down.
And we thought the more sick they are, the more dominant sympathetic they would be. And then more suppressed parasympathetics, and then we found these chronic cases.
And they really lost both. Ooh. And then on the flip side, in their healing, both would come on. And you'd get a kiddo that you're like, well, he has a really high sympathetic nervous system and he's thriving. And historically, we would think, well, maybe that shouldn't be that high. But really the key was you needed a good balance in both, because the autonomic nervous system's smart, right? We say it as chiropractors all the time, right? Let innate do its job. This is one of the things, you have all the science behind it, but innate needs to do its job, and it needs to have power to be able to switch and make those decisions.
Yeah, and isn't that this episode? Isn't that this session? We do talk about, so what we have is, number one, as a chiropractor, we get to have the understanding that innate knows a million times more than us, but we also, as practicing neurologically focused chiropractors in 2025, we have a lot more understanding of innate neuroscientifically than we ever used to. And that, because in our world, innate is the nervous system. I know it's more than that philosophically, but the function of innate, the storehouse and operating system of innate, is the nervous system. We get to work with a much more advanced understanding of the nervous system than our, people that came before us. And so I think what I'm getting at here is we know more, so we should be able to do better. I feel like that's our responsibility to our patients and to this profession. When you know more about how the nervous system works, about how subluxation destroys nervous system function, and about how chiropractic restores it, you get better at it. You know how to make certain clinical updates that weren't around a few years, even in our own practice. And so, HRV, power, body battery, to get a kid or a patient healing. So if you look at HRV, and on the inside, we get two measurements. We get the activity index, power, battery score, and we get left versus right. Oh, in my sympathetic sway or in my parasympathetic. The first most important is the up and down, right? The y-axis to power.
Absolutely.
Don't worry about, no, we will worry about it eventually, but at first we don't worry about left versus right, right?
Yeah.
If it's tanked.
No, absolutely. And I think this goes into the exact answer, and we'll jump ahead.
We're getting into the solution,
we're getting into
aren't we?
We are.
Is classic Tony, sorry.
And simply because what happens first, right? When say you have a healthy kiddo. You have a healthy kiddo, a healthy baby, and they're born, what system's supposed to activate first? The sympathetics, right? Even when a baby's born, they have this sympathetic surge that is supposed to be a good sympathetic surge, the safe sympathetic.
That's actually why some of those reflexes are there. It's supposed to be jumpy.
Exactly. So first phase, right? First phase of this, of this, and this is where I'm going to interview you.
I'm such a solution son of a gun. I can't. I often skip over the problem, don't I? And really painting that picture.
So what is the first stage of subluxation?
So it's what we were taught. Well, and it's funny because we're going to say this is the first thing we've been taught and known forever, because we got got to learn from the Dr. Chestnuts, the Dr. Murphys, and the Dr. Fletchers. So we've always had an understanding that the first worst component of subluxation isn't necessarily the biomechanical. And remember, we're on a neurologically focused podcast, so we're doing a neurological definition of subluxation. Stage 1 is excessive sympathetic dominance. So this, I don't love this word, Matt, but it fits because we're going to talk about the chronicity and the progression of these stages. So you can think of it as the acute initial response of subluxation is to fight. The nervous system is going to go into protection mode. So it's going to go into sympathetic overdrive, which is the exact same thing as saying parasympathetic exhaustion. Or actually, let's not use that word yet. Parasympathetic suppression, right? Parasympathetic interference. We'll get to exhaustion. And so you have this acute early stage of dysautonomia setting in, and we know it's there for infants. We know it's there for toddlers. The problem is, and we're going to go slow and talk about each of these stages individually, there's no like line in the sand where 1 becomes 2 and 2 becomes 3. They happen pretty quickly in sequence. It's its own perfect storm neurologically, that A begets B begets C. But the first stage is sympathetic dominance. The system tries to fight. The parasympathetics start to get tired, and you're just in that initial. So that's the colicky baby. That's the meltdown tantrum kiddo. So clinical presentations is more of a raging bull, fight or flight stuck case.
Yes. And that's what I was just going to ask, because it's the misdiagnosis, behavioral, right? Disorders, ADHD, anxiety, hyperactivity, sensory overload. A lot of times these are the kids, they're not sleeping well. They're colicky if they're babies. And so they get lumped in. We call it the raging bull side of it, where sympathetics are stuck on. So it revs up everything. Parents don't know what to do.
Because it revs them up.
It revs them up. And so, the medical for answer that we know that the sad story is, you go medication, but don't worry, or either one, they'll grow out of it or medication, totally depending on where they're at. True. But really it's that sympathetic system responding to that subluxation saying, hey, I'm more in fight or flight. So I need to boost that power of that sympathetic
And here's
system.
the clinical application of this. So if we kind of like sneak in a little bit of clinical application to each stage as we go through it, that's why so often you can take a, 2-week-old, 2-month-old brand new baby. They can be literally, we'll call it riddled with colic. They can be screaming, crying 18 hours a day. They could have been a mess for the entire life since they've been here earthside for 2 months, constipated, difficulty latching. You make 2 adjustments and it's like the clouds part, angels sing, scans clear, the kid sleeps, kid poops, kid's calm. You have work to do to kind of get them back to baseline. But if you have a brand new baby, they're very likely only in stage 1 of subluxation. So clinically, it's a lot easier to handle. So your care plan can be according to that stage. Your adjusting plan can be real light, real easy because you're working with a raging bull. Once you get into stage 2 and stage 3 here that we're going to clip through, you have a lot more work to do clinically.
Yes, and it's that you start, and you've heard it said this, you layer on top of it, right? And a lot of that is not only because the 3T is coming in, but it's the development going in the other direction. So like you mentioned, babies, there's not a whole lot they're responsible for autonomically, specifically, right? Eat, sleep, poop, rest, chill. There's no motor to speak of besides some of the fine motor stuff with the, the jaw, the latch, the neck and head control.
Bit of head, neck,
But that hasn't really got there yet. It's just those autonomic functions. And so if you haven't layered that on yet, and they had a difficult birth, if you can get that baby adjusted early, you don't have the layers of developmental stress that have come on it too.
How many times have we, right? Uncle Matt and Uncle Tony'd into the hospital and seen, these worst traumatic, terrible cases, and that kid comes out pretty well because of your early intervention. And it's neuroscience. Like you're getting ahead of the subluxation when it's still in these early stages instead of, because subluxation is its own perfect storm. Subluxation isn't static. It's not going to stay stuck at the neurological dysfunction level it's at. It's going to get worse. And that's not a fun conversation, but that is neuroplasticity. That is neurological wiring. Nerves that fire together, wire together. And then, yes, development is raging on. Subluxation is going to interfere with and distort development. So now things are going to get worse.
Yeah, and that's the best conversation that leads us to stage 2. because you'll start to see when subluxation sets up shop, the body has to adapt around it because the brain is always going to go towards efficiency. It wants to be as efficient as possible. So if you've got a gut problem, if you're constipated, well, what's it going to do? You've seen this in babies, right? They start to get a skin rash. Yeah. The nervous system's going to get that out however it needs to. It might be refluxy, it might be skin rashy, might be different ways, but it's got to detox, right? And that's one of just the only examples. And so stage 2, we start to see this dysregulation and confusion in the nervous system because innate, if you will, still knows what to do.
It's trying,
it's doing its work, but it just can't do it because the layers before it aren't set up in the most efficient manner. So it's literally having to take the long way around to make everything go well. So in this phase, and this is where I'll be the interviewee.
In a kid, it sets up shop pretty obviously.
And I love your conversation here because this is really where the perfect storm becomes relevant for kids. With everything coming at it, what does that neurological disorganization and dysregulation really look like?
Well, so when you get to stage 2, which we put a lot of terms together with stage 2 that really mean the same thing. So when subluxation sets in, then dysfunction sets in, dysregulation sets in, dyskinesia sets in. So that's where that's always at play. So you're going to have abnormal motor development. So when you get to stage 2, and let's just call it disorganization. Okay. So you have this neurological confusion. That's kind of our nickname we've loved to give it. And now every single core function of the body gets confused. It gets dysfunctional. And so it's going to go in order. If you take development, which is our other favorite, we were joking before we came on, like, what's your favorite thing to talk about? The neurological developmental hierarchy and triangle or the 3 stages of subluxation? And the answer is both because they actually merge together.
And we'll have episodes on all of them.
We will. So, that one's hard because that's super visual, right? The triangle, but so it'll be difficult on the podcast, but we'll do it. So the way development happens, the most important thing to nervous system health is sensory motor tone. So the neurospinal system, that proprioception, mechanoreception, sensory motor is the actual nerd term for it. The brain is more attenuated to say, hey, my neuromotor tone and coordination needs to be, your word, efficient, symmetrical, balanced. And if it is, the brain is happy, it's regulated, and movement dictates development. So the very first thing that stage 2 throws out of whack is motor milestones. So sensory motor development. And we could go on and on for hours about how that wreaks havoc. Head, neck control, tummy time, rollover, proprioception. And everybody out there, everybody in the neuro world knows that if you distort motor development and you delay or throw off, motor milestones, you're at risk for autism and brain base. So we'll get to the brain. Second, though, is the motor system on the inside. It's called the gut. We forget, we don't, as chiropractors, it's a muscle. Esophagus is a muscle, stomach's a muscle. They're called smooth muscles. Remember your 4-colored pen in school? And your anatomy, what do we have, mortar? No, he was CNS.
Torgrud, you had...
Mika? No,
we're just calling
we're just Palmer people help me out here.
Shout out to all you Palmer
shout
people,
out, yeah. So you take these and you're like, oh, the smooth muscle is different because it's under autonomic control. And so the second thing, that stage 2, subluxation, confusion, dysfunction, dysregulation, it'll show up in the sensory motor system first, it'll show up in the digestive system second, it'll show up in the respiration and the immune system third, and it'll show up in the endocrine system fourth. Now, in today's world, everybody wants to talk about autism as a gut-brain connection, it's a microbiome connection, it's a gut immune, it's a neuroinflammation. Well, all of that can be tied to stage 2 of subluxation. The reason the microbiome is distorted and dysfunctional, the reason the sensory and PTs, OTs, they work with that first system, sensory motor system. So they're right. There is distortion. There is developmental delays. So put all that together, and I know that's a lot, and we want it to be because this is advanced neurology. And as a pediatric chiropractor, you can't go bone out of place, musculoskeletal issues. You got to understand it with this depth. And so that is where developmental delays really start to kick in. That kid starts to get sick, brother. They get sick on the inside. They get sick with their immune. When we say sick, we don't just mean, immune system. Their gut's a mess. Their immune system's a mess. But you can't miss, I'm saying it probably the 7th time here, it's actually the motor system that gets subluxated and distorted that everybody else misses. And that's what's got to get back online to ever get the brain back online. But often stage 2 is because what just happened? Every single system of the body started to dysfunction, right? And become inefficient. So eventually real quickly, and eventually that kid runs out of gas.
And here's the practicality of this, of what we saw in practice from it. The things that you just see table side every single day in kids that are neurologically confused. You would see it come out in their motor system. They were your toe walkers. They were your kiddos that, yes, they might have got signed off by the pediatrician where, they were walking by 15 months, but they weren't really walking coordinated and organized by 15 months. They were a hot mess.
It's hard to describe how funky it is.
And I think, in Talladega Nights, like they could only turn left, right? Man. Like there was a motor dysregulation that only us chiropractors really could see. And that is very confusing to the cerebellum brain. And then, like you said, for it. And that's why I think it's so key that you emphasize the motor, because this is what we'll all pick up on practice is, yes, you're going to see the autism symptoms. You're going to see the special needs. You're going to see the constipation. You're going to see all these things.
Chronic ear infections.
Yeah.
RSV.
You're going to hear all that from mom. They're going to come in and present with that. And then you're going to watch their neuromotor systems, how they move, get on the table, get off the table, play in the playroom, come into your office. And you're going to be like, oh my goodness, this kiddo is subluxated in a way that no one has ever pointed out to mom.
And this happens, stage 2 happens, dysregulation, dysfunction comes from the asymmetrical components of subluxation. So subluxation has misalignment, yes, but if you really, so this is what's so cool about the insight. The insight allows us to measure 3 components of subluxation and look at them, yes, individually, but it allows us to look at them collectively too. And I like both viewpoints, individual and, so you have amplitude. So that would be sympathetic dominance. So the first thing we look at on a thermal or an EMG is we look at tension. It's not probably the best word for it, but we look at amplitude, right? We
tension
look at
tone,
tension or tone being increased or decreased, right? You see both. Then the second thing on an NCM and on an EMG symmetry view, in fact, being a neuromotor, sensory motor, perfect storm guy, I look at the EMG asymmetry view first, and then the pattern view. That's like my sequence of what I look at, because that's what I'm looking at on the kid when I assess them, right? When I palpate them, when I go through and looking for the distortions. So stage 2 subluxation will show up with severe asymmetrical clinical presentations, your head tilt, your rotation, your unlevel shoulders, your torque tip. And so whether they're static and you see it, or it gets worse when they're trying to move, because you can't move efficiently. You can't develop sensory motor system with the asymmetrical component. But what do those 2 things lead to? The tension, the tone, and then the asymmetry and the confusion, they lead to stage 3. And so this is where we started to see it, right? We started to see it on our complex. And I think as long as I've been in practice, I would expect to see exhaustion. I didn't understand it to this degree. That's what I was talking about in intro. Like, I think I always knew this was happening, but I couldn't articulate it. We didn't have the HRV data table depth and assessment we have then. I would see it on parents. I mean, come on. What parent hasn't reached it? Or teenagers who really had a heck of a journey.
And I think it was very diagnostic. It was adrenal fatigue, right?
Or depression even.
Yeah,
I hate to clinicize. Yeah,
depression.
You don't want to pathologize subluxation, but yes.
And you saw that, and
or the autistic child who just
completely unengaged and locked in, and you saw that, but we never put that neurological term to it because we never looked at all of this together, like we were saying, to see. Number 1, sympathetic dominant. Number 2, state of confusion for a long time. Sometimes though, maybe not so long if it's a heightened state of confusion. And then we get to this exhausted point where the nervous system has fallen off a cliff. It's still confused. It's still pissed off. It's still angry.
Still worn out.
But it's also exhausted really too. And this is the, lack of a better word, it's the toddler that didn't get its nap. No. Like that is not only just, going everywhere, but it's just chronically tired. So it comes out in, you can be very, very wound up, but then you're also neurologically worn out.
So think of it, I know we're on a podcast, everybody, and so we can't grab our eye. So we love teaching this stuff at our seminars because we have slides, we have whiteboards. We love teaching it in the adjusting rooms because we have whiteboards and we have our scans and we have our posters. So you guys stick with us visually. So coming back to the story of Dr. Fletcher, who when we brought this to him, he was like, oh yeah, he's so smart. He goes, well, yeah, that's called the sympathetic cliff. And we were literally live seminar. And this is how you and I operate. When he teaches, even though we're teaching with him, we grab our notebooks or I open up my phone to my notes app. I always know I'm going to learn something. Tomorrow during my interview with him, I'll probably get a little pissy because I'm going to want to take notes while he's talking. It'll look weird on camera that I'm taking notes. But anyways, so he goes, oh yeah, Tony and Matt, and room, that's the sympathetic cliff. And he just explains it beautifully, articulately, and he even visualizes it. So here's the visual. It's a bell curve. right? Meaning, so a bell has that kind of like peak and round at the top, and then it falls off to the other side. So when a patient is on sympathetic dominance and they're fighting for so long, that sympathetic excessive overdrive will go up and up and up. It can only go up for so long, and then dysregulation and confusion sets in. So you know what happens at dysregulation and confusion? Development gets stunted. Development gets stopped. So now this line of sympathetic surge actually squares off. So now you have a stressed out, wound up, developmentally delayed, dysfunctional, dysregulated system, and eventually it falls off the cliff, and now the bell curve goes to the other side. And so that's when the HRV, even the sympathetic metric, will collapse. And now we'll look at these HRVs, which on an adult, you're like, okay, well, this sucks massively for this adult, but goodness gracious, man, when you run we call them dual exhausted, meaning the sympathetics and the parasympathetics have blown out. So if you're taking notes, write it down as dual exhaust. And when they both shut down, and it's an infant, or a COVID kid, who's 3, 4, 5 years old, or a teenager, it is absolutely heartbreaking. But I will say this, and we'll turn the corner and get here to close this one. It's way less heartbreaking than it used to be because we know how to handle it clinically.
Exactly.
At least we know, at least we're finding it with our depth of scientific understanding, and most importantly for these parents and for us as these kids' doctors responsible for changing their lives, we're finding it with the technology. So I would not want to practice today at all, number one, without this understanding of the 3 stages of subluxation. But even if I had the understanding, if I didn't have the technology and the insight scans to know that I know, we're dealing with stage 2 and stage 3, so I can care plan, we can care plan and adjust accordingly, that would be flying blind. That would be, not a practice environment I'd want to be in.
No, and I think that's important because the goals parents are coming to us for are big goals, right? Huge. It's not just, okay, get rid of the ear infections. It's, hey, I need help with seizures.
It's long since passed.
I need help with speech. My kid has autism.
Level 3 regressive autism.
How do I help him have a successful life with what that means for that child?
And when does regressive autism kick in? When they hit stage 3.
Exactly. And we've always known what subluxation does, right? It's the inverse of growth and development, right? It's literally in the back of the well-aligned folders that we use every single day. Shout out well-aligned. Yeah, totally. We love them.
We're really helping out our homies out here, aren't we? Yeah,
just
totally,
look at this. Just add them.
Yeah, totally.
Get the sponsors out.
Yeah.
But on the back of the folder, it literally shows the graphic where when you're subluxated, you're not in growth and development. And that's exactly stage 3 subluxation. So that's where you get to, that point where you're like, crap, what do we do? And the good thing is we've always known what to do as chiropractors. We know to adjust. We know if you're following us, if you're PX, we know we need to care plan,
this
right?
Isn't a
we need to do these things.
Intervention.
But it helped us do them with more clarity. Perfect. Because there is a certain formula to this, especially when you really fall off that cliff and get into exhaustion, where there's things just matter most in that phase that we can do that's going to get them out of that phase.
Go back to the curve. You got to kick the power back on. Somebody has to at least get a freaking backup generator tied into Innate and say, give it a chance, homie. So you literally have sympathetic, and this is so key to pediatrics because number one thing you got to do when you have stage 2 and stage 3 is you have to care plan accordingly. So if you're taking notes, care plan accordingly. You know what happens when a kiddo is exhausted? They don't hold an adjustment for crap. That's an Iowa Tony way of saying it. Like literally, you got a shelf life of about me running. Okay, so I'm sitting across from an endurance runner, and I'm a sprinter. Yeah. So they have no endurance. They exhaust quickly their innate capacity because they're so exhausted. So they are wound up, dysregulated, and now they're exhausted. So that's the stage: wound up, sympathetic dominant, stage 1; dysregulated, stage 2; exhausted, stage 3. You have to address stage 3 first. So in chiropractic lexicon for a long time, it's been called retracing. It's in this book sitting right on our shelf next to us. I love that. We have rephrased that as reorganization. And what we know is neurological reorganization, the sickness, the subluxation, the dis-ease sets up in those 3 stages. You have to address stage 3 first within your care plan. So we high dose care plan. And if a patient is neurologically exhausted, well, what we like to say and joke is you got to bring out the paddles.
Get out the paddles.
You have to arouse innate and you can't wuss out.
Yeah, because the care plan matters. The second thing we'll talk about is your technique does matter.
Sure does.
Right? Because if that motor system's very, very valuable, we talked about that all in stage 2. And think about the get out the paddles. When the nervous system's exhausted, there's just no life to it. It's not even an efficiency conversation at that point. It can't be efficient because both the parasympathetic system, sympathetic system, they're completely shut down.
You can't organize
They're worn
exhaustion.
out, right? You can't even have a balanced conversation at that point. So you need to get out those paddles and you need to get input into that nervous system to wake it up. These are often your most chronically fatigued, subluxated patterns. And we won't go too deep in here, but oftentimes they're in different places because the technique matters, but then the primary matters too. They're in different places than we even expected. We grew up in the age of where upper cervical, right?
If you literally only stopped with an understanding of stage 1, sympathetic dominance, and then you had a misunderstanding of what subluxation is, and you think that upper cervical and sacrum only, elicit parasympathetic, and that if you were adjusted thoracics or transition zones, you would elicit a sympathetic response. That is just simply not true. Scientifically,
so we saw more exhausted subluxations in the thoracics and in the transition zone specifically, because when a kiddo went through those growth developmental milestones, they couldn't hit them appropriately with their movement patterns and with what's supposed to be proprioceptive, rejuvenating for the body.
And efficiency.
So they weren't efficient. They were disorganized. And so when they fell off that cliff and got into exhaustion, well, what was the worst of the worst? It was those transition zones. It was those thoracics. So in a way, this changed our paradigm that said, hey, if we're going to go after exhaustion, you need the care plan. Frequency and time with the care plan, a lot of them both. You need the technique, get out the paddles, more HVLA, more get things moving neurologically, right? You can have a tonal and a manual adjustment. And then third, you need to make sure you're in the right spot, in the right region.
Real estate, location matters.
Location matters. What primary are you going after first to clear the exhaustion first? Because if you clear the exhaustion first, then game on, the nervous system has some power to it, to come back to that word, to say, okay, well, now I can start working through these secondaries.
Now I could regulate again. Now I could reorganize again. Now I could seek out balance again. And so this is going to be a son of a gun for a lot of people listening. This is a listen to 3 times over. If this is the first time you're learning from Dr. Matt Hill and Dr. Tony Ebel on the neurological, when we say we're neurologically focused chiropractors and subluxation focused chiropractors, guys, it's not just filler for you to come to our seminar and then we talk about the spine and teach you how to do, play PT and OT and do exercises. Like, we literally take this thing to the most amount of depth. And so, because clinically it matters. And so this is as deep, actually probably a little bit deeper than we planned to go on it, but your 3 moves clinically that you have, like, this is our job. This is what we test people on during our certification course in conjunction with Life University is, what's the care plan? What's the primary? And then what technique are you going to use? And you've got it in these chronically complex cases. So we'll kind of close it down a little bit with this conversation. If you're in a family practice and you have the brand new colicky baby and you know that stage 1, because it's tricky, because a lot of us, even when we were neurologically focused and trained, Matt, when we learned this tonal, principled, nervous system focused model, dude, we only learned sympathetic dominance. We were told everybody is sympathetic dominant, so adjust accordingly, right? That's it. And so that's just not the case. We are living in the most stressed out, then also dysregulated, then also exhausted population. And if that didn't make sense when you hear it today, wherever you are right now, just look around. Just look around at kids. Bags under their eyes, pale skin, posture collapsed. Look around at parents. Exhausted, right? Then look at your chiropractic patients who get full throttle chiropractic and you'll see kick-assedness. So anyways, so here's the 3 levers. Your care plan, your adjusting, and then your adjusting location, your primary, and then your lever. And so when we teach this with Life University at the post-certification, we spend hours and hours and hours taking each of these individual stages and going as deep into the neuroscience. We bring cases to the table to say, here's what we're looking at in case history. You do CSI, chiropractic science investigation. We bring scans up, HRVs, data tables, DTGs, EMG collapse, and signal exhaustion. And we look at them and we see these stages of subluxation. Then actually, everybody listening, you've never been in a seminar that goes to this depth and you've never been to one that delivers with this clarity. We actually bring cases in. We bring kids, not dolls, to the seminar. We don't adjust each other and say, oh yeah, now you know what you're doing, right? And then a dysregulated, exhausted kid comes into the room and is like, yeah, actually, I'm not going into the room. So all those like palpatory and things you learned, throw them out the window. So you got to understand this stuff. I'm on one now, but the seminar has real life cases, and we actually choose, you and I had this real conversation years ago about our certification and about our training, and like, should we pull it back a little bit? Should we back off some of this, teach them maybe just to be a family wellness doctor in level 1 of the certification, and then teach them to be a perfect storm complex case? And we just looked at the world we're in, and more families than not have a severely dysregulated, exhausted kid. So if you don't know how to handle this, you can't be in family practice today, because you will leave families underserved.
And you know, I was a dad before I became a student and then a doctor of chiropractic, and I fell in love with the adjustment. I always thought it was interesting going through school, going through my initial training before I found PX, that the value on the adjustment wasn't what I expected it to be from a patient standpoint even. And I know that sounds interesting coming from this world, but if you're a chiropractor that's been through this arc, I know you know this, is we've been taught that, hey, go ahead and adjust. Just adjust. That's going to be enough. Well, if you just listen to our last, 40 minutes of this, that's just a page of what goes in to our brains when we want to adjust. And so when that dad or that mom, when they come to you, they're like, oh, are you an office that only adjusts? Darn right we are. We're an office that puts every single thing, years of art, science, philosophy, everything into that adjustment. So if you're a chiropractor that has basically said, man, like, I love using my hands, I love the healing power I can get with these kids by exactly what I do, but it's just been kind of put to be like, yeah, it's a tool. It's a tool. No, it's the tool. And it's the tool because of everything that goes in it, because of the stages of subluxation, because of the details that we talk about this with. So if anything, let this podcast help you fall in love with that again, the power of the adjustment, because it gets you out of these 3 stages of subluxation.
This is how we roll, man. You know, sorry, little shout out to Florida Georgia line right there, because when you understand it with this depth, it forces you, it compels you to apply chiropractic at that depth. And everybody, we'll close her down here. If you do now. I was about to say, if you only knew that chiropractic was this powerful, how do you understand that chiropractic is this powerful? Unfortunately, you have to first understand that subluxation is that detrimental. Subluxation is that destructive and damaging to an entire family's life. Because you know what happens when your kiddo is chronically sick? It destroys the well-being, the happiness, the joy, the fulfillment in a large way for the entire family. So the perfect storm is just, you could take it in so many directions. And so when you get into this science, like we do, in the land of the most nerdy neuroscience, I love it. Some people are like, oh, PX, you know, that's where you go for business coaching, right? And marketing and branding. Oh, God. Guess the reason we are so damn good at marketing and branding is because, again, we feel, because we are compelled and forced to get this message out. We've taught this on the Experience Miracles podcast. Parents now often understand depth of subluxation and the power of chiropractic more than chiropractors. So we're done with that, okay? We are going to lead this profession to a greater depth of understanding as to exactly how impactful you are. And then that should absolutely compel you to want to get better. Remember, we kicked this podcast off. We're going to talk about a depth of understanding of subluxation, depth of the detrimental effects of subluxation, which is the same thing as saying is the depth of power and impact and life transformation that only chiropractic applied at this level can deliver. But those are the key words, brother. You have to be ready to apply it at this level. So when you're going to give somebody a real care plan, guess what? Your communication has to be freaking probably better than it is now. Your team, your practice, you know, your systems have to match to this. And so everybody listening, if you just nerded out with us, if you're right now jaw dropped, you're sympathetic dominant, but also exhausted because you're like, holy cow.
If you're listening to this in the car with the kids, you're like, maybe I need to have a notebook, right?
When we found it, you know, I'll never forget that day at the seminar. I can picture us at Willow Creek when Dr. Fletcher, like, we'd been studying, looking at data tables, and then it was like, dang, there it is. Because it changed everything for our clinical results, and we only exist for them. We are doing this podcast to work through you to those kids and family in your community, because they not only need chiropractic, but 2 times a week for 6 weeks chiropractic when you're dysregulated stage 2, neurologically exhausted stage 3. Well, in Iowa, folks, we call that peeing into the wind, and that's just not going to cut it, okay? So, of course, I would close it with an Iowa inappropriate metaphor. So this is one of the episodes that we're actually going to do it, Matt. We are going to put the link to our certification and certificate of proficiency program with Life University into the show notes. You have never, I'm not going to do this on most of the podcasts, so I'm going to, close hard, but you have never attended a cert course and an adjusting seminar like this. We took them all. Actually, I might have been able to shortchange you a little. I headed you off in the past a little bit, right? I was like, okay, you don't have to sit through all of them. But I took every other certification and adjusting seminar out there, and you actually hit it perfectly. They were like, oh yeah, you're going to adjust, right? Well, that's all this is. Chiropractic is on the same plane as primitive reflexes and lasers and nutrition. No, it's not, because the nervous system isn't on the same plane as gut function. The nervous system is in charge of it. So if you need to level up, hit that link and get front row. Matt and I will teach this. If you loved this hour, imagine freaking 80 hours of it.
If you love Iowa farm jokes, guys, I'm telling you, be there. It will not be boring. It is just the favorite 2 days. And it just happens that we've got one right around the corner. So we are prepped for it.
It's 20 hours of CE and a cert from an actual university. See, Life University's postgraduate doesn't just sponsor our CE hours, and it's not just us. So everybody else's certification, we know this because we did the homework on it. Everybody else's certification is basically like, that would be the Tony and Matt certification. No, this is the first one that an accredited university is actually saying, this is your certificate. And so it actually stands out not only for its clinical delivery within pediatric chiropractic, but it's the only one who your piece of paper actually has some real teeth from university.
Yeah, and more chiropractors finish that and just their passion is ignited.
It's going.
Right? And so much of that, if you're watching this today and you feel like, hey, I've been doing this for a long time, I feel like I'm on an island out here, I'm fighting the fight, come join us, man. You're going to have so much passion, certainty, clarity coming out of that just game on. And that's the point, right? Is we want to work not only to train you, to train us to all get better, right? We want to work through you to help more kids and more families. And that's really the purpose of even this podcast, right? It's great for us chiropractors. We nerd out on this stuff, but that kid, that family, that mom, that dad, they absolutely need this.
I think we have a responsibility to chiropractic too, brother. Literal, actual last thought. Sometimes I think I get almost awesomely, excessively out of balance. I'm so obsessed with patients, community, impact, and their results. Sometimes I think I'll kind of like skip past, our needs as chiropractors and how much we really do deal with subluxation. You want to talk about the chiropractic journey gets into stage 2 and stage 3. So many chiropractors out there are dysregulated, disenchanted, and exhausted with chiropractic because they didn't know that it has this. So I think our experience, hence why we named it the pediatric experience, it's for them, the experience kids will live, but this is a kick-ass experience. We're having more fun in practice than ever, taking on these tough cases. I have fallen more in love with chiropractic philosophy, science, and art by understanding these 3 stages. I've never been more tapped in my career. And I'm probably somebody who could say, oh, this is cruise control season, right? We could back off. But now when you take care of kids, it's all in. So if you just want to fall head over freaking heels in love with chiropractic again, get to that freaking seminar. Blow your mind.
Love it. I love it, guys. Well,
okay.
If you
download,
smash
that subscribe button. Let's pretend we're our kids watching YouTube. Yeah.
Do all those things.
Yeah,
right?
Tell
those,
Mr. Beast to tune in.
Yeah.
Dude Perfect. Let's get their kids
Get some
adjusted.
good edits on here. Cut out all the bad jokes. But we love you guys. It's been an honor sharing this with you, and we just can't wait to help you serve more kids.
Let's go, brother.
We'll see you soon.
Love you, brother. Hey, Dr. Tony here, and I wanted to say thank you for listening to the Family Practice Podcast. If you enjoyed this episode, like and subscribe to the show so you don't miss a thing. Also, if you're looking for more content from us, you can absolutely subscribe to our newsletter, watch exclusive episodes on YouTube, and dive deep into the articles and blogs on our website. All of this is linked in today's show notes. Thanks again, and we'll see you on the next episode.